about allergic rhinitis. This is an inflammation disorder. Again, it's usually from something out in the environment. Sometimes you can be allergic to food and have histamine release or and inflammation, but it's usually from pollen, grass, mold, your environmental allergies. Some of the medications, though, that we take for those are nasal inhalers. So that could be, for example, Flonase. There's a whole list of them out there, and many are over the counter now. Veramist, there's a whole list of them. Antihistamines, oral and intranasal. So when you think intranasal, we think Astelin or Astapro, as well as there's a couple of other ones out there. But as far as oral goes, that's going to be your Benadryl, which can make you tired. So most people will take, because it crosses the blood-brain barrier, most people will take Zyrtec, Claritin, Allegra, or Zyzal. The third one is the sympathomimetics, oral and intranasal. That's your Afrin nasal spray that opens things up. There's also some oral ones. These types of medications, they mimic responses due to stimulation of the sympathetic nerves. So what they do is they directly activate the adrenergic receptors, or to directly activate them by increasing norepinephrine and epinephrine. So when you think of Afrin, that's basically what it is. It's giving yourself a little bit of epinephrine into your nasal passageway, and it vasoconstricts and it opens up your nasal passage. There's also the common cold. So most of the time it's a viral infection. Sometimes it can be more of a bacterial issue, but common colds are more of your coronaviruses, which we probably never really talked about until COVID-19. But there are multiple coronaviruses out there, and that's your common cold. Respiratory infection that causes your sore throat, your headache, nasal congestion, hoarseness for a few days, and then you end up getting a cough. Kids get fevers quite often. Adults don't get it as much, and it's usually, as we know, self-limited. It's here to stay. Everyone gets colds. So how do we treat that? Well, I tell my patients, you can spend a lot of money with over-the-counter medications, and I don't know which one's going to work. We can treat the symptoms. We can't cure it. So I do the best I can at giving them some remedies that they can get over the counter, and I ask them what their symptoms are. So nasal decongestants, there's antitussives such as Robitussin, there's Triaminic, there's Delsum, there's analgesics, antihistamines, and there's also caffeine, they say, because it offsets the effect of antihistamine. Very interesting. So with these, you can tell patients to go get NyQuil, but it's really not, this is what I've learned. Why give somebody NyQuil with 5 different major ingredients in it when they don't need it? And you also have to be very careful with patients with hypertension. They should not be taking those medications. And some people on antidepressants should not be taking dextromethorphan, which is like a Robitussin DM. Anything with DM, dextromethorphan. So I know a lot of people are out getting the maximum amount. Just because it's over the counter does not mean it's safe. With children, it's a whole different ball game. And years ago, since I am older, my kids it was recommended that they take Delsum and Robitussin and those types of things when they were little. Well, a lot of studies came out saying that there really aren't any studies on those medications with kids. The only medication that's really been studied on kids is Benadryl. So Benadryl is a very safe medication with a wide range of dosing, but we try to avoid any over-the-counter cold remedies, even if it's marketed that way. A lot of times if you should check out the pharmacy and see the over-the-counter stuff for kids. Now, they have changed the labeling for some of them through the years, and it should say on the back, don't give to anybody younger than 4 years old. And also, it should be whatever's recommended, obviously, by the nurse practitioner, or pediatrician, or PA. So this is just an overview of pediatric medications.